Hey everyone, Ryan here and welcome back to our orthodontics series. This video is going to be all about development of occlusion. And we're going to talk about that through 4 different stages. We start with the gum pad stage, we move to the primary dentition stage, then mixed dentition stage, and we finish up with the permanent dentition stage. So in the gum pad stage, this is from birth to 6 months, and it ends with eruption of the first primary tooth. So we simply have just pads of gum tissue without any teeth present. You can see the incisive papilla, and each gum pad gets segmented by these little transverse grooves that demarcate where each tooth bud is currently developing. The lateral sulcus is this portion here and here. Also on the bottom, we can see the lateral sulcus area, which is a more prominent groove dividing the eventual primary canine from the primary first molar. It's only useful if you wanted to judge the inter-arch relationship super early on in someone's life. The primary dentition stage is from 6 months to 6 years. So it's from the first primary tooth coming in to the first permanent tooth coming in. So young children in this stage often have a minimal overbite, minimal overjet, where these incisors overlap, and sometimes even an anterior edge-to-edge relationship. We'll talk more about those specific terms in the next video on diagnosis and treatment planning. But there are a couple of staples of the primary dentition stage that we should review. So when primary teeth erupt, there are 3 different kinds of spacing that we should expect to see. Interdental space technically refers to space between any teeth, but we use it to describe space between the primary incisors. Spacing between primary incisors is not only normal, but necessary if we want to prevent crowding of the permanent teeth, because they're bigger than the primary teeth that they replace. Those permanent incisors outsize the primary incisors by quite a few millimeters. So this difference in size between the primary and permanent front teeth is called incisor liability. So we need this space if we want to avoid crowding when we go to permanent dentition. The primary spaces are between the primary maxillary lateral and the primary maxillary canine, and then on the bottom it's between the primary mandibular canine and the primary first molar. The leeway spaces refer to the difference in combined mesiodistal width of the primary canine, first molar, and second molar, and the underlying permanent canine, first premolar, and second premolar. So as opposed to the incisor region where we lose space during the transition of teeth, here we actually gain space during the transition, mostly thanks to these premolars that are smaller than the primary molars that they replace. There are a lot of conflicting numbers out there, but I would remember 1.5 millimeters of space per side in the maxillary arch for 3 millimeters total, and 2.5 millimeters of space in the mandibular arch per side, so 5 millimeters total there. We covered both of these primate spaces and leeway spaces concepts in our pediatric dentistry series when we talked about space management and how we can utilize these spaces proactively to our benefit. So when those primary teeth erupt, there can be any amount of relationships between the molars in the upper arch and the molars in the lower arch. And this is measured by the terminal plane of the primary dentition. In other words, the most posterior or distal tooth surface, which is the distal surface of the primary second molar. So this molar relationship can be either a mesial step, where the mandibular terminal plane is located mesial to the maxillary terminal plane. It can be a flush terminal plane, where those terminal planes are literally flush with one another along the back, or distal step, where the mandibular terminal plane is distal to the maxillary terminal plane. So why is the terminal plane used? Well, the first permanent molar is going to be guided along this terminal plane as it erupts. So the terminal plane relationship will determine what is to come later when those permanent molars finally erupt, because they're coming in distal to these teeth, so they're using that plane as a guide for their eruption. Now, when that happens, we'll talk more about the mixed dentition stage in the next slide. As far as our frequencies here, mesial step occurs about 49% of the time. Flush terminal plane occurs in about 37% of the patients. Distal step is about 14%. So we're going from most common to least common here. Now, how I like to remember mesial step versus distal step is I draw a staircase in my head on this side of the teeth. And so this stair step can support the letter M. Now this stair step can support the letter D. And this stair step can be on the mesial surfaces, this stair step can be on the distal surfaces, or you can think of it as, like we talked about before, with why it's called mesial step and distal step. Whatever works for you, that's what I would remember. All right, so now we go to the mixed dentition stage, and this is from 6 years to 12 years, ending with exfoliation of the last primary tooth. So this is the period of time, and it's all about the transition from primary to permanent dentition. It's sometimes called the transitional dentition for that reason. So during this stage, we're going to have all those spaces we just talked about, interdental, primate, and leeway spaces are starting to close. And the molar relationship will transition from that terminal plane relationship to class 1, class 2, or class 3. So the ugly duckling stage is part of this mixed dentition. And this gap between the upper central incisors is a hallmark of the ugly duckling stage. This is about 11 to 12 years old, and less than 2 millimeters is completely normal. Now, the mesial eruption of the maxillary canines should close this space, meaning that when those canines come in, these teeth should be slightly pushed together and this space should close just a little bit. Now, a gap larger than 2 millimeters may need some subsequent treatment, and that canine eruption wouldn't be enough to spontaneously close that ugly duckling space. When the board exam asks about ugly duckling stage, they like to ask about what teeth have a diastema between them, and that would be the upper central incisors. Now, during this mixed dentition stage, we're having an anterior transition and a posterior transition. So let's talk about each of those separately. So in the anterior region, we have permanent tooth buds that are developing lingual and apical to their primary teeth. So the incisors tend to erupt lingual except for the upper centrals. So the incisors are reflecting the position of their tooth buds. All incisors tend to erupt lingual to their primary teeth, except for the upper central incisors, which are pushed labially by the tongue as they erupt. The canines also tend to erupt labially, and they can also erupt laterally to increase the width of the arch. We'll talk more about arch development at the end of this video. And then the posterior transition has to do with all of this occlusal terminology. Now, there's a lot going on this slide. We'll unpack it one piece at a time, but this is an infinitely helpful picture. It's showing what many orthodontists have tried to study over the decades. Can this primary molar relationship predict what the permanent molar relationship will be? Can that terminal plane guidance be enough to confidently predict what that permanent molar relationship will end up like. So, because if a young patient comes in, they present a certain way, can we tell the parents how they'll likely end up? So let me just go through these really quick. Class 2 or distal occlusion means that the mandibular first molar is distal or too far distal in their relationship with the upper molar. End to end or cusp to cusp is where the cusp tips of both molars line up with one another. Class 1 is normal occlusion, where the mesiobuccal cusp tip of the upper first molar occludes with the buccal groove of the lower first molar. Angle class 1 is considered a normal or correct occlusal relationship. And then class 3 or mesio occlusion is where the mandibular first molar is too far mesial. So, can we predict posterior occlusion? Well, there's definitely some truth to that assumption. Again, first, permanent molars are guided into position by the distal surfaces of the primary second molars. So they slide along those terminal planes as they erupt, so there's definitely some correlation here. Based on this landmark paper from the 70s, if you're a distal step, you are almost at 100% chance to wind up class 2. So you're almost 100% likely to end up class 2. If you're flush terminal plane, you'll most likely end up end to end, although you could wind up actually being any of these relationships. So you could even become class 2, but more likely you're going to be end to end, maybe class 1. You can maybe even wind up class 3. So it's truly the wild card primary occlusion. If you're a mesial step, you'll most likely be class 1, although there is a 10% chance or so that you'll slip into a class 3 molar relationship. Now, the truth is, if you're end to end, you don't really stay there. You'll either go spontaneously to a class 2, or more than likely, you'll wind up class 1. So the question becomes, well, it might make sense how each of these goes across this blue arrow from distal step to class 2, flush terminal plane to end, mesial step to class 1. That all kind of makes sense. But how about this arrow here? How do we get from flush terminal plane to class 1 or mesial step to class 3? How does that really happen? Well, there are really two different reasons. There's differential jaw growth and differential shift of teeth. So now we have to go down here. How do we get from flush terminal plane to class 1? Differential teeth shift and differential jaw growth. So we have early mesial shift. It's one mechanism. It's where the lower permanent first molars erupt at about 6 years of age, and they shift mesially, closing the primate space distal to the primary mandibular canines. Now, this doesn't really happen in the maxilla, so you're getting net forward movement of those lower molars. So we're getting a little more slippage of those molars forward, and it's favoring this dark green arrow. The late mesial shift occurs when the lower primary second molars exfoliate. This is around age 11 or 12, and the permanent first molars shift mesially into the leeway space. So this happens in the upper arch too, but remember there's more leeway space in the lower arch, as we said before. So you're again getting net forward movement of those lower molars. And then we also have differential jaw growth. So the mandible grows forward relative to the maxilla later in life. And that's from that cephalocaudal growth gradient we talked about in the first video. And so if that lower jaw is growing a little bit more later in life, it's going to carry those lower teeth with it. So all three of those mechanisms, both tooth shift and jaw shift, are working to help that flush terminal plane get to our ideal class 1 relationship. So pretty cool stuff. And the board exam will mostly ask from this slide on early mesial shift and late mesial shift. How I remember this is E for E at the end of primate, L for late, L for leeway. And you can also remember 6 and 12 as the ages when those things occur. So a lot going on in that slide, but I hope that helps to break it all down. So we can do something called a mixed dentition space analysis in these mixed dentition patients. And it compares the amount of space available and the space required for the incoming permanent teeth. So how you do this is the amount of space you have available minus the amount of space required for the permanent teeth. And that will predict how much either crowding or spacing you will end up with. Crowding is represented as a negative number, spacing as a positive number. Because crowding is really just a math problem comparing arch dimension and tooth dimension. So that's really all this boils down to, crowding as a math equation, looking at arch dimension, how much space we have available for the teeth, and tooth dimension, how much space those teeth will actually consume. So there are a bunch of different analyses out there, but we'll talk about 2 of them that frequently show up on the board exam. But all of those analyses seek to predict the same thing, the mesiodistal width of the unerupted buccal segment. That's the canine, first premolar, and second premolar. No matter what analysis you use, you want to have this sort of presentation. You want the lower incisors to be already erupted, and the rest can be either primary or permanent. But this is what you're looking for, those lower 4 incisors to be erupted, and we'll talk about why that is. So the first one is the Tanaka-Johnston mixed dentition space analysis, and this involves the sum of the width of those mandibular incisors, and then you plug that into a simple math equation. So we have those 4 lower incisors, we're measuring them usually on a cast, sometimes in the patient's mouth, but usually on a cast with a Boley gauge, so we can really get some nice, accurate measurements. And along with that, we need to use a calculator. So we take the sum of those 4 mandibular incisors, we divide by 2, and then we add 11 millimeters, and that will give you the space required for 1 maxillary buccal segment. We can instead add 10.5 millimeters, and that'll give you the space required for 1 mandibular buccal segment. And again, buccal segment is canine, first premolar, second premolar. The Moyer's space analysis uses the same, you need to do the same kind of measuring. You need to get the width of those lower 4 incisors, but this time we don't need to use a calculator, we simply refer to a prediction value table. So you get that total mandibular incisor width, you go to this column here, you find the closest number, and then you can figure out what is the predicted width of a maxillary quadrant buccal segment and a predicted width for a mandibular buccal segment. So 2 similar, they're actually very similar in how they work, but the difference is you're using a math equation or you're using a preformed prediction table. And finally, we're going to have the permanent dentition stage. And so this is from 12 years to either death or edentalism if you end up losing all those permanent teeth. So this is when you have all the primary teeth are now exfoliated, they're all gone, we're left with only permanent teeth, and that ends when we lose all those permanent teeth, or that's it. So arches have a curvature in the permanent dentition stage. This is this natural sagittal plane curvature as curve of Spee, or frontal plane curvature, which is curve of Wilson. We talk a little bit more about that in the prosthodontic series if you want to learn more about those concepts. Ideal overbite in this stage is 10 to 20%. Ideal overjet is 1 to 3 millimeters, and ideal occlusion is class 1. We'll talk more about these concepts in the next video. During this permanent dentition stage, we get what can be called late lower incisor crowding, especially later on in life. This refers to anterior crowding that often gets worse in your 20s, 30s, and 40s. And that's because the tendency during the 2nd to 4th decades of life for anterior crowding to get worse is due to this lower lip pressure against late mandibular growth. So what does that really mean? Well, there's this prevailing theory that we experience a small amount of mandibular growth and we get lengthening of the mandibular ramus, which can occur later on in life. It's very, very gradual. It's a very small amount, but it's still there. And so it'll carry these lower incisors forward, and this causes those incisors to feel extra resting pressure from the lower lip. And so what do? They can tend to tip lingually to escape that pressure, decreasing the arch length and causing crowding without the regular use of a retainer to hold them in position. So we talked a lot about what happens to the teeth during all this time, but what about the arches? Remember, I said crowding is a math problem between tooth size and arch size. So just as the teeth transition to a permanent dentition, so do the arches. So we have a couple dimensions to consider here. Intercanine width is measured from cusp tip of one canine to the cusp tip of the contralateral canine. And this increases as the permanent teeth erupt, particularly from a labial and lateral eruption of the canines. And then it will stabilize after eruption of the canine. So this is by age 10 to 12 once the canines are in. Intermolar width can be measured from several different landmarks actually. This diagram shows us measuring from central fossa to central fossa on the upper, and from the distal or maybe mesial cusp tips of the lower molar to the contralateral molar. But you can also measure from, some people measure from the gingival margin to the gingival margin, and they say that's the most stable landmark. So there are a couple different ways you can show intermolar width. But what's important is that this value will increase as the molars erupt, and then it will eventually stabilize. Sort of similar to what's happening with the intercanine width. Now, the important thing here is that you get more expansion in the upper arch than the lower arch due to a difference in direction of eruption. The upper molars will tend to erupt divergently, whereas the lower molars will tend to erupt more convergently, and that has to do with the curve of Wilson, which is something we mentioned before. But in both arches, you're still getting an increase, and then it'll eventually stabilize like the intercanine width. For arch length, or arch, sometimes called arch depth, that's measured from the facial of the incisors to this line that's tangent to the mesial surface of the first permanent molars. And so this arch length will actually decrease during the transition from the mixed dentition to the permanent dentition. And that's true for both arches. And that's because of the leeway space. So the first molars are coming forward to close that space once those E's, or the primary second molars, exfoliate. So you're getting probably a more decrease in the lower arch because we have more leeway space down there, but you are getting a decrease in both arches. And finally, arch perimeter, sometimes also called arch circumference. This is measured using that same mesial tangent line, and it's measured from the mesial of the first molar around the curve of the arch to the mesial of the contralateral first permanent molar. This one's a little bit different. The maxillary arch perimeter increases very, very slightly, and in the mandible, it decreases significantly from the mixed to the permanent dentition. And this one is a bit more complicated because this kind of arc measurement factors in both the antero-posterior dimension as well as the transverse dimension. And so the difference in the increasing upper, decreasing and lower has to do with a combination of the labial and lateral eruption of the canines that saw an increase in width, but then we also have this competing loss of leeway space that decreases the anterior-posterior dimension. And because of that, more leeway space in the lower, we're getting an overall decrease in arch perimeter, whereas in the upper, we don't have quite as much leeway space lost, so that ends up being a net increase, mostly due to those canines erupting laterally to increase arch width. So that is the 4 main arch dimension changes to keep in mind for the board exam. All right, so just to review, we talked about the gum pad stage. This was from birth to 6 months, primary dentition 6 months to 6 years, mixed dentition 6 years to 12 years, and then permanent dentition 12 years and on. All right, so that's it for this video, guys. Thank you so much for watching. Please like this video if you enjoyed it and subscribe to this channel for more on dentistry. If you're interested in supporting this channel and what I do, please check out my Patreon page. Thank you to all of my patrons for all of their support. You can unlock extras like access to my video slides to take notes on and practice questions for the board exams. So go check that out. The link is in the description. Thanks again for watching, everyone. I'll see you in the next video.